I am Mike Verbsky, and I am the Director of the Diabetic Management and Education Program and the Inpatient Amputee Rehabilitation Program and Outpatient Support Group at Momentum at South Bay of Paragon Health. I hope you have enjoyed the videos posted on our Paragon YouTube channel so far. But today, I'm going to discuss with you about the importance of maintaining good foot care when you have diabetes. Diabetes is a disease in which the body's ability to produce or respond to the hormone insulin is impaired, resulting in abnormal metabolism of carbohydrates and elevated levels of glucose in the blood and urine. As this relates specifically to foot care, your diabetes can result in neuropathy or impaired sensation, calluses, foot ulcers, skin breakdown, decreased blood circulation, and possibly amputation. Let's take a moment and go over each of those risk factors. Skin changes. The skin may become dry and cracked or peel. This is caused by nerve damage that controls the ability of your body to control moisture. Calluses. This is a result of high pressure areas along the bottom of your foot. These calluses can turn into open sores if not addressed properly. You should keep regular appointments with your podiatrist. For self-management, use a pumice stone on wet skin and use lotion right after using the stone. You should never use chemical agents or try to cut off the calluses on your own. This becomes an avenue for infection. Poor blood circulation. This occurs as a result of narrowing and hardening of the blood vessels. You should be working with your physician to control your blood pressure and cholesterol. Keep up your activity level and exercise daily to stimulate blood flow. Foot ulcers. Ulcers occur as a result of poorly fitting shoes. Proper attention by your physician or podiatrist is necessary once you notice any ulcerations. Neglect foot ulcers could result in infections and amputation. If ulcers do not heal properly and you have poor circulation, then managing your blood sugars is important, as high blood glucose levels make it harder for your body to fight infection and heal ulcers. Amputations. These occur due to peripheral artery disease and decreased flow, as well as neuropathy, which decreases sensation. It's easy to get ulcers and infections which don't heal well, and the result is amputation of the affected area of the body. Caring for your feet is very important in order to avoid serious complications. You should wash and dry thoroughly your feet every day. Keep your toenails well trimmed and make sure to file down sharp edges. This will decrease the risk of cuts and open areas, which are avenues for infections. Every day, you should be checking your feet for sores, cuts, blisters, and reddened areas. In order to minimize moisture in your shoes, which can lead to blisters and skin breakdown, wear moisture-wicking socks. This will help keep your skin dry. You should always be wearing good shoes and socks and not walking around barefoot, which increases the risk of stepping on sharp objects and damaging your skin. Also, check inside your shoes before putting them on and make sure there are no sharp objects in them, such as small rocks. Again, this is Mike Verbsky, and I'm the Director of the Diabetic Management and Education Program and the Inpatient Amputee Rehabilitation Program and Outpatient Support Group at Momentum at South Bay of Paragon Health. In addition to the Diabetic Management and Amputee Rehabilitation Program at Momentum at South Bay, we also have two other programs at Excel at Woodbury and Limbrook Restorative Nursing in Limbrook, New York. If you have any additional questions about how to manage good foot care and hygiene, please reach out to the members of your healthcare team. For more educational videos presented by the team members of Paragon Health, please reach out and see more at www.paragonhealthnet.com. Thank you for listening for a few minutes.